Thank you, Professor Davidson, for the introduction. Hi, everyone. Good afternoon. My name is Sukanya Joshi. I'm a master's in data science student here at Penn, and today I'm going to be talking to you about COVID-19 contact tracing app reviews and the concerns and motivations around their adoption. So just a show of hands, how many of you guys have actually used or heard of a COVID-19 contact tracing app before? All right, cool, a good amount of you. So for those of you who don't know what that is, it's basically an app that alerts you when you've passed by someone who's been infected with COVID-19. So early in the pandemic, states across the country used these applications to help keep people safe. However, only 1 in 14 people had downloaded these apps in states where one was available. So our main research questions were, 1, due to its low uptake, what are the motivations and concerns of users who downloaded these applications? And number 2, what are the most common themes found within the positive, neutral, and negative app reviews? So first we went on to collect our data. We got over 7,600 user reviews from both Google and Apple app stores. We got this data from a time frame of 2020 to 2021 during the height of the pandemic. And as you can see in the map over here, the states which are filled in green are the 26 states which actually employ these exposure notification systems. So moving forward to our methodology, after we collected these user reviews, we went on to a data pre-processing section of it where we categorized these reviews to positive, negative, and neutral. Positive reviews were the ones where people gave them a 4 to 5-star rating. The neutral reviews were given a 3-star rating, and a negative review was given a 1 to 2-star rating. We then moved on to remove our stop words and tokenized our data, after which we performed feature extraction and statistical testing to identify the meaningful themes within the positive, negative, and neutral categories. So our first extraction of our features was the n-grams. So we extracted the 1, 2, and 3 grams of all the reviews, and these are basically just 1-word, 2-word, 3-word tokens. We found the words which were highly associated with all of these different review categories. The second feature that we extracted were the topics. So in our case, topics are basically clusters of co-occurring words in the data. So for example, words like company, wage, or employee would all be clustered into one topic. We use this by, we generate these topics using LDA, which stands for Latent Direct Allocation, and it's basically an unsupervised clustering algorithm to generate these themes. So why did we choose LDA? There are so many different topic modeling algorithms, such as CTM, which stands for Contextualized Topic Modeling, and NMF, which stands for Non-Negative Matrix Factorization. So what we did is that we actually generated the themes using all 3 different topic modeling algorithms, and we found that LDA had the highest coherence scores. And what that means is that the topics generated by LDA had the highest quality and were the most representative of the data. So once we proceeded to extract the features, we wanted to understand how the n-grams and topics vary across these user review categories. We performed statistical testing to identify the significant features, and we used a p-value of less than 0.05 to indicate these meaningful associations. We wanted to mainly understand how these feature dimensions vary across positive, negative, and neutral reviews. We found some interesting results. So positive reviews mainly had words such as great app, simple, easy to use, thank you, versus negative ratings had mainly words such as doesn't work, useless, and waste. At the same time, the topics associated with positive reviews mainly consisted of easy to use, good experience, gratitude, unity, and then a need for more downloads. We also went ahead and calculated the odds ratios for all of these different sets of topics. And what that means is that, for example, the easy to use category over there, these words are more likely, 8.05 times more likely to appear in the positive review section than the negative and neutral categories. In terms of our negative reviews, a lot of the people thought that they're facing a lot of functional issues. So they were unable to receive these exposure notifications. They were unable to review these COVID-19 test results. They also had some issues with verification, and when they downloaded the app, it seemed to be draining their battery. Some people also believed that the whole pandemic was a hoax, and they failed to even download the app, and they just left their negative review there. So when we went to see the neutral reviews, these are the people who gave the app a 3-star rating, we could see that a lot of the overlap comes with the negative reviews. There are a lot of still, issues with the functionality of it. However, some people did have some improvement suggestions on how we can create a more effective app. So in terms of the overall distribution of ratings from the scale of 1 to 5, we can see that people, about 78% of them, had, categorized them as a 1-star or a 5-star rating. So, this means like people with the most extreme sentiments were more likely to leave a review. So overall, we can see that positive reviews mainly consisted of, ease of use, encouragement for other people to download the app, as well as engage in COVID-19 precautions. Whereas negative and neutral reviews discussed issues with app functionality, installation errors, tracking location, etc. We can see a 5-star review from an information security officer who basically says that this app is amazing and has a privacy in detail when it was created. He talks about his colleague who received a notification on his phone about being possibly exposed. That colleague of his later went to get tested and he was tested positive. And due to the strong capabilities of this application, he was able to save his elderly parents from exposure. On the other hand, we can see an example of this negative review where it shows, exposure alerts weren't working because there were just simply not enough downloads for it. And county health public departments just didn't have enough information to provide them with. The limitations of our studies, as a result, one of the largest barriers to success of our applications was getting people to download them in the first place. People were unaware that these apps existed in the first place. Furthermore, individuals with non-extreme sentiments were less likely to comment. Finally, the topics and themes that I showed you before, they might as well be varying per platform, or they could be varying by state, but our sample size was not powered enough to compare these insights per platform, so we went in for a more aggregated data set. So what is our takeaway? So first, uptake was the biggest barrier to success, as stated by all categories of reviews. Both positive and negative reviews suggested that more people should download them in order for these applications to be more effective. Secondly, our research can help app developers fix bugs and issues to increase their user engagement in the future, and states can better position themselves in the future with this feedback by providing incentives and enhancing marketing strategies for getting more people to download them. Overall, the main purpose of these COVID-19 exposure notification systems is to help keep people safe and to help protect our communities. We hope that our research contribute to that sentiment by creating more effective public health applications in the future with a much higher uptake. That leads me to the end of my talk, and I would just like to take a moment and thank you to all the amazing staff and faculty members that I had the opportunity to working with in both Penn Engineering and Penn Medicine. We actually published our research, so if you're more interested in reading more about it, you can scan to this QR code to see more. But other than that, thank you so much, everyone. I hope you guys have a wonderful day.
Thank you, Sukanya, for that talk.